I'm Dr. Jacinta Klindworth. I am a family medicine physician in Hazen and Beulah, North Dakota. I'm a staff physician at Coal Country Community Health Center in Beulah, Hazen. I am chief of staff of the hospital here in Hazen, Sakakawea Medical Center, and I'm also currently the president of the North Dakota Academy of Family Physicians. When we're talking about risks of vaccination for COVID-19 in comparison to the risks of natural infection with COVID-19, the risks of natural infection are significantly higher. Unvaccinated individuals, especially, can have moderate to severe illness that may require hospitalization and ICU stay. And unfortunately, as we know, hundreds of thousands of people have died from COVID-19 during the course of this pandemic. There are risks to vaccination. It's not a zero risk intervention. Nothing really in medicine is. There's no medicine that we take that has no risk, but the risks are very low. There are expected side effects from the vaccine. Typically, these are things that you will experience as your body mounts an immune response. You may have a sore arm, flu-like symptoms, maybe some headache and fatigue. Usually these are very short-lived, but those are to be expected. The question I get from parents a lot is this risk of myocarditis or heart inflammation with regards to the vaccine. But I also try to explain that myocarditis or heart inflammation is a significant risk with COVID itself. And it's actually amazing that we have identified this risk. It means that our monitoring systems are working, that the V-Safe program is working and picking up some of these very, very small risks. The risk of heart inflammation or myocarditis from the vaccine is about 1 in 20,000. This was the reported risk in the adolescent studies. We know that it's more common to happen in young males versus young females. But if you look at the risk of COVID-19 infection, that risk is about 1 in 40 or 2.5%, so much higher. And then unfortunately, if you have children that progress to that MIS-C, that multisystem inflammatory syndrome of children, the risk of myocarditis is upwards of 50 to 75% in those children. So it's a huge, huge risk compared to that 1 in 20,000 risk of vaccination. So I think that's one thing I try to tell parents as well, is to really make sure we're comparing apples to apples when we're looking at risk. I think that's really important, and the degree of risk, again, for vaccination is much lower than natural infection. The other thing we see with natural infection is the long hauler syndrome. There's some studies that report that in pretty significant numbers, and people struggling with post-COVID syndrome. As far as the risk of long hauler, excessive fatigue. Some people don't get their taste of smell or taste back, or it's distorted. Some people have chronic headaches, memory issues. There's a lot of things that go along with it that can be very distressing and very debilitating for people. Unfortunately, there has been a significant amount of misinformation, whether it's how the vaccine works, what potential side effects there are, what the true risk of COVID infection is. And there are a lot of people that are just afraid. They're scared, they're nervous, they're worried. This is probably the most studied vaccine we've ever had. We had tens of thousands of people receive this vaccine before it ever became available to the general public, which is significantly higher than many of the other vaccines that we use routinely. So the safety is there, the efficacy is there, specifically with regards to the COVID vaccine. My patients that come in and that ask if they should have the COVID vaccine, we talk about their personal risks of getting sick. If they have diabetes, high blood pressure, obesity, heart disease, chronic lung disease, absolutely, I would strongly recommend that they get vaccinated. We look at, those people that have young children in their home who can't be vaccinated. The best protection for those children is that those around them are vaccinated, very similar to influenza vaccine and some of our other vaccines. In my 20 plus years as a family physician, I have seen amazing things happen through vaccination. There are diseases that I treated as a medical student and as a resident that we just don't see anymore because of vaccination. For the safety of your family, my family, your loved ones, it's time to get vaccinated.